Welcome everyone. Today is 19th January 2021. A lot of good things are happening all around the world and we'll come to it. Vaccine is being rolled out, and particularly about vaccine, there are a number of questions which need to be answered and a lot of confusion, misinformation, disinformation, etc. Let's keep it straight. Let's put it on the facts. Um, Issues, first of all, the CDC, FDA, and MHRA in UK, they've got a mandate to make sure that the people are safe and nothing untoward has been given to them. They should not be harmed by the vaccine. Instead of helping, they should not be harmed. So that's one thing is certain, that vaccine must be safe, effective, and affordable, which they are making sure. That's an important thing. Available vaccines are many by now. In fact, America has got Pfizer and Moderna. Novavax and Johnson and Johnson are coming in a few days, I suppose. British has got Oxford AstraZeneca, which is great. It will be produced in 60 different countries, uh, and uh, and that will be all around the world very soon. Um, Vaccines. Some of the vaccines haven't got the published data, which is not quite great, I would say. And that they are, for example, let me show you the those vaccines are Chinese, Russian, and Indian. They already started vaccinating. They say it is in clinical trial mode, which is again, government must be fairly confident that it must be working right. Um, some need cold chain. Oxford and Bharat does not, and Sinovac does not need it. Most important, I think, question with all of us is, when will we have the herd immunity and when can we be back to our normal lives? That's a difficult question, but we know from the past experience that 70 to 85% of people, when vaccinated, that will probably give us a good herd immunity. Our population is 7.5 billion. Under 18 will be about 5 billion, and under 5 billion, and 75% of that will be 3.75 billion, and two doses will be 7.5 billion, which is a very large number. If we get enough number vaccinated in one country, that's not a good thing. We have to vaccinate the whole world, because otherwise, any place on the world is about 24 hours away from each other, and we can get infected again from somewhere else. So we need to make sure that everywhere the vaccine is given, and the vaccine is definitely reaching everywhere. Um, all over the world, the number of vaccines that have been given until now is in 51 countries. And from December 8th until now, 44 million doses have been given, and 2.25 million doses are given every day. But this is not enough, because this will take years to cover that. As I said, 7.5 billion doses. The most important concern is, presently vaccine coverage is only in rich countries, and that is not good enough. As I said earlier, Director General of World Health Organization says that the world is on the brink of catastrophic moral failure in sharing COVID-19 vaccine, which is not good. This is because he sees that the vaccine is not being equitably distributed. Now let's talk about vaccine. How is it being given in USA? USA, by end of 2020, Trump administration had promised 20 million doses to be injected. As of today, only 14.3 million have been given. New administration is taking up charge tomorrow, and they promise 100 million doses in first 100 days, which is, I think, a good speed. But even there, we will take a few months, and we will be in summer, almost, or midsummer, when we will be, or end of summer, I suppose, when we'll be finishing all the doses. So that's where we are. I think we need to really make it as fast as possible. New administration is going to involve FEMA, National Guard, Defense Production Act will be activated, etc. And hence things will be better. Mask mandate will be for all federal buildings and interstate highways. By April, it seems that everyone will be openly, it will be open time. Everyone can get the vaccine, whosoever wants it, because those preferential groupings must have been vaccinated by now. In UK, they are planning to give the whole of the UK, all one dose at least, by the end of June, and well, probably second dose as well. Uh, Israel is already given 25% of the population already vaccinated. Now, let's talk about the variants and mutations that is really causing a lot of questions. We have started finding out so many variants, and those are because we are doing the genome surveillance everywhere and genetic sequencing. Genetic sequencing marks the changed amino acid at a particular number, and that's the number that is given. And hence, there is a lot of confusion about the numbering and the nomenclature. For example, the UK variant is named this several different names as you see on this slide. South African variant goes 2-3 names. Brazilian variant, Californian, Germany. I don't think we need to confuse ourselves in that. What is important is that the variant and mutations can be tackled within a few weeks by fine-tuning the vaccine, as I understand from the British authorities. They have got new manufacturing facilities also coming in. Now, one more question: is it affordable? Yes. In most of the countries, it is free. The Europe and the America. Although the price of the Oxford will be $2.75 per dose, Pfizer is almost $20 per dose, and Moderna is even more expensive. Others we will don't know the prices and we'll know. Is it safe? I would say certainly yes, because FDA has made them wait for 60 days after the vaccination first clinical trial was finished, and when they saw that there was no side effects, they allowed the vaccines to be injected. So now what? Let's talk about now what. And now what is very simple, and that is we have survived a year. Congratulations for that. Now we need some more patience to make sure that we stay around for a few more months. Don't put our guards down. Stay at home if you can. If you have to go out, mask is important. Don't meet any stranger. Keep your hands in the pocket. Observe 6 feet distance. Think that everyone is infected. So don't meet any stranger. Don't go near them, and keep a distance. Um, Please get vaccine as soon as is possible, because that is one of the most important thing. And very good luck to you. Best wishes for the winter, and hopefully we will probably start getting out in summer very soon. All right. Okay. Thank you very much. Good day and good night.